The Portfolio Committee on Health has concluded its first round of public hearings on national health insurance in Mpumalanga. The bill is introduced or was introduced 2 months ago and is currently going through a public participation phase. After this, it will be sent to the National Assembly for a vote. For more on this, we're joined in studio by the chairperson of the Health Portfolio Committee, Dr. Sibongiseni Dlomo. Dr. Dlomo, thank you very much for your time. So, fresh from Mpumalanga, first round concluded. Firstly, how many areas did you visit in Mpumalanga and what's the reaction on the ground, or perhaps response on the ground?
No, thank you very much for this opportunity. We visited 4 places in Mpumalanga, starting from Komazi local municipality on Friday, which was an afternoon meeting, where we had about, I think we had about 700 people who attended that first meeting. The next day we moved to Bushbuck Ridge, local municipality. We also had a good crowd of close to 800 people were in that venue. The next day we went to Tembisile Hani, local municipality, where Wakafontein, actually we found about 300 to 500 people there. And the last was yesterday in Emelo, where there was also about 800 people who had attended in those meetings. So it's quite been a good response on the ground when you can then find people ready and willing to engage on this national health bill.
Any specific areas that people were interested in? These are members of the public who experience firsthand government's health services.
It's quite interesting, that they actually they've read the bill and they've understood significant on it when they engage with us. Of course, we're there to listen, learn from them and take all that back to Cape Town. But our people were really very vocal in linking up the process with what actually they experience currently to say, yes, is this bill going to, among other things, deal with the long queues that we have in clinics and hospitals? Is it going to deal with the shortage of medicines? So they were pointing on certain things that I'm glad that the Department of Health was with us all around, because they are pointing on things that we could find on what we call a presidential compact. There was a health summit called by the president where actually was checking as to what are the challenges in health, and all those things listed in there are things that would probably be able to, if they are sorted out by the department, will enable NHI to really fly. So that's very important that they should attend to those issues.
Members of the public will often seize an opportunity like this because in front of them are government officials. Then you have the oversight arm of the state, which is yourselves. Any horror stories that stuck out for you? Because they surely must have shared some of their experiences.
We were glad that we are right, Coley. We got a 2-in-1. One was to listen to our people about the NHI, the bill itself, but number 2 was to also not close our ears on the raising issues that they were pointing out. Really, look, that province is still struggling in terms of, one, they don't have a hospital as big as some of the hospitals called central hospitals. So sometimes it takes a bit longer waiting time for patients to actually access a tertiary and quaternary type of services. Number 2, ambulances. It's actually been an overwhelming cry about the shortage of ambulances in and around the area. But we also learned that recently there's been some injections of new ambulances in certain areas by the MEC. But those are the things that we're actually saying we delay so much and we end up maybe finding a death in the family that otherwise would not have happened if the ambulance was on time. Also, they are experiencing shortages of staff, which is something that we probably, people were very vocal about here and there, that they still have shortages of staff in clinics and hospitals. So our being there with the MEC for health in that province is actually giving us coming back to the province to say, what have you done on these issues? And also they had an opportunity to look into the issues that were raised by our people there.
Dr. Dlomo, this bill is, once concluded with these public hearings, will go back to Parliament. We'll follow that process as when it unfolds. But a key question, and very briefly for me, the overall impression from the people of Mpumalanga, do they trust the public healthcare system or do they not trust it because of the experiences?
Look, they are pointing on the challenges that they have with the public health system.
So they don't trust it?
Not that they don't trust it. This is the only vehicle that they have in terms of they are aware how overburdened it is. Look, the report of Judge Ngobo tells us that there are challenges in our health system, both private and public. And we are running away from the story that always says there are challenges only in the public health sector. Now we know from an independent report of Judge Ngobo that we should also look into our systems also in the private health sector. So those two systems put together needs to work in. That is why our NHI is going to give us a way forward, because we are looking into both challenges in the private and also in the public health sector.
Your next stop?
We are going this weekend, as we leave your studio, we are going back to do our work in the Parliament, and then on Friday we leave for Northern Cape. We're landing in Kimberley, and to Kimberley, Uppington, Ta'a, and Springbok, and then we wrap up Northern Cape.
Dr. Sibongiseni Dlomo, thank you very much for making the time.